Let's learn about the correlation between education and better health. We've kind of learned about it already, but let's learn a little bit, because guess what? The issue of Medicare for all and healthcare for all directly correlates very nicely with the issue of free public education all the way up to the PhD level. You know, the two issues very much work together. So let's learn a little bit.
Education is associated with better health outcomes, but trying to figure out whether it actually causes better health is tricky. That's the topic of this week's Healthcare Triage. People with at least some college education have mortality rates, deaths per 1,000 individuals per year, less than half of those without any college education, according to the Centers for Disease Control and Prevention.
And this is true, by the way. The mortality rate is lower for people with a better rate of education, and it seems to have almost an area of effect, as we've seen from other studies on this issue. The more educated your area is, generally the higher the life expectancy of everyone in that area.
In addition, people who are more educated exhibit less anxiety and depression, have fewer functional limitations, and are less likely to have a serious health condition like diabetes, cardiovascular disease, or asthma. But causality runs both ways. People in poor health from a young age may be unable to pursue education as much as those with better health. On the other hand, a person who tends to focus on long-term outcomes may be motivated to develop healthier habits like regular exercise, even if blocked from a pursuit of higher education. Some clever studies have teased out the causal effects of education by exploiting natural experiments. One, by the UCLA economist Adriana Lares Mooney, relied on state compulsory education laws enacted between 1915 and 1939. These laws required some children to obtain more education than they might have otherwise, resulting in longer lives for those that did so. According to the study, having an additional year of education by 1960 increased life expectancy at age 35 by 1.7 years. Studies that relied on inducements for greater education because of a poor labor market or as a way to avoid the Vietnam draft found that increased education led to better health and a lower likelihood of smoking. This finding is one clue about how education may improve health. It can reduce people's engagement in risky behaviors, perhaps because these behaviors could threaten the higher income that greater education typically confers. But health behaviors can explain only a portion of the relationship between education and mortality. Education may also provide skills to analyze information and tackle complex problems, precisely what's needed to navigate the modern health system and attend to chronic diseases. Higher level of education is also associated with higher income and greater wealth, which are also correlated with better health. Again, causality goes both ways. You have to be reasonably healthy to keep a job or to work long hours, for example. But higher income often comes with better health insurance and easier access to healthcare. Much of income's effect on health may originate in childhood. Many studies demonstrate that children of wealthier parents are in better health, perhaps because of better access to prenatal care and nutrition, or because they live in less polluted environments.
This is 100% true. Minorities who have been redlined into worse environments, which is typically what happened in lower income areas that many, for example, African Americans tended to be isolated in. There is, regardless of income in those areas now, even if the income has gone up, those environments tend to be heavily polluted and lead to worse health outcomes.
Healthier childhood often means a healthier adulthood, and children born to higher income parents are more likely to obtain more education and have higher incomes themselves. That's how the income-health relationship may propagate across generations. Greater education and wealth can also confer greater social status or rank, which has also been linked to health. A landmark study published in 1978 found that higher-ranking British civil servants, like administrators, had lower rates of mortality due to coronary heart disease than lower-ranking ones, like messengers. Lower-ranked civil servants tended to be heavier. They had higher blood pressure and blood sugar and smoked more. Many investigations have replicated this relationship between social rank and health. One study linked childhood poverty to chronic stress and subsequent reductions in memory, which could affect education, wage attainment, and health. Even stress endured in pregnancy can affect the health of the fetus in ways that endure throughout life, research suggests. Health also varies by racial and ethnic identity, which also tend to play a big role in social standing. For example, African Americans have higher rates of mortality than white Americans, even after adjusting for income and education. Here, too, there are childhood origins. African American infants are more likely to be born preterm
Samantha
and with lower
Banana.
birth weights. One reason may be less access to prenatal care. African American patients are also less likely to receive preventive health care and more likely to live in areas with lower quality hospitals and doctors. Disadvantages and stress stemming from a history of discrimination and community segregation underlie these and other disparities. Hispanics tend to be healthier than comparable non-Hispanic.
Samantha Banana, are you still here? Because we are doing a Medicare for All organizing stream right now. You should click this link and sign up to this Discord and get involved in the fight for Medicare for All. And if you want to share that link around, feel free. We are trying to get more people involved in the fight for Medicare for All, and I'm working with the Be a Hero Foundation to make that happen. So let's do it together. I bit my tongue as I said that. My bad. Thank you. I appreciate you.
White Americans, despite being poor on average. The Hispanic paradox, as it's known, could be because
Psh. Snips, you can still get involved even if you live in a Republican hellhole. The very first ask is just writing a letter to your senator, which it helps you do. It's real easy to get involved, and you'll just get updates on different fights in different places. You got this. I believe in you.
Hispanic immigrants are typically in better health than native U.S. residents. People who are healthier in the first place may be more likely to migrate, or it could be because of health behaviors. For example, Hispanics are less likely to smoke or drink frequently than their non-Hispanic white counterparts. In this century, there's been a sharp rise in so-called deaths of despair, suicides, drug overdoses, or alcohol abuse for middle-aged white Americans without a college.
There's literally a book. I thought he was going to reference it. There's literally a book called Deaths of Despair, written about the economic conditions of health in this country.
College degree. Even as mortality rates for the poorly educated have risen, the rates among those with some college education have held nearly steady or gone down since 2007. In 2012, researchers found that life expectancy for white women without a high school diploma was 73.5 years, compared with 83.9 years for white women with a college degree or more. For white men, it was 67.5 years for those without a diploma, compared with 80.4 years for those with a college degree or better. Just as our health is affected by lifestyle, genes, the environment, and the health system, education has a role too. We can't yet say exactly how much or exactly why, but a decrease in longevity associated with lower education levels may help explain why overall American life expectancy has declined slightly in recent years and fallen well off the pace of progress of most other advanced nations. Hey, did you enjoy this episode? You might enjoy this other episode.
So yeah, we have this issue right here, education and better health, very strongly correlated together. So literally by providing free public education to the PhD level, we would be improving the health of people in the United States across the board. And by, adopting Medicare for All, we can further reduce the barriers that might prevent somebody from going to get their higher education. This is a fantastic idea. Well, it's also because they engineer unhealthy food to be addictive for profit. Well, sure. Who is the cute smart man? That was Healthcare Triage, channel with shockingly over 400,000 subscribers. Not, I don't say shockingly because that was a good video. I just mean I did not expect that number to be that large based on the views for the video. Here's a good little Democracy Now! Bit that we will now watch with our eyeballs about Sweden, free higher education, universal healthcare, and free daycare, and why we can't do it in the U.S.
Democracy Now!, democracynow.org, The War and Peace Report. I'm Amy Goodman. We're broadcasting from Stockholm, Sweden, from the Open Channel. As Democratic presidential candidates debate Medicare for all and making public higher education free, we turn now to look at how Sweden has built one of the world's most extensive social welfare systems. Here in Sweden, healthcare costs are largely subsidized by the state. Daycare and preschool programs are mostly free. Higher education is free. Public transportation is subsidized for many users. To look at how Sweden does it, we're joined by Mikael Törnvall. He's a Swedish author and journalist focusing on economic issues at Svenska Dagbladet, a Stockholm daily. His most recent book is titled Who Should Pay for Welfare? Mikael, welcome to Democracy.
Amy Goodman just like casually saying Swedish words correctly is very impressive.
Now, it's great to have you with us. So we just have a few minutes here to explain a lot of issues that I think are very misunderstood in the United States. You've lived in the U.S., you live here in Sweden. Talk about Medicare for All. Talk about your healthcare system. How is it paid for?
So it's almost entirely paid for by taxes. And I know that scares a lot of you guys, but the thing is we pay... For me, at least, I pay almost equivalent in healthcare taxes than you would pay via your employer for health insurance. But what I also get by that is that I don't have any co-payments to talk about. It's the maximum co-payment for healthcare in Sweden is a few $100s a year.
Explain your own personal situation. What happened with your daughter?
Yeah, that happened a few years ago before we moved to the U.S. She got ill and she had a brain tumor, fortunately not a deadly one. She got operated on by one of the best surgeons in Europe.
How old was she?
She was 12. She got excellent care afterwards. We stayed as a family at the hospital with her for a week, and she then had follow-up care for several years. She had to go to a doctor every few months, and we paid nothing for that. Because she's a child until 18. You don't pay anything for healthcare.
Holy shit.
So then you come to the United States and you're shocked.
Yeah, and what happened there was she needed, for some reason, she needed to go to the hospital in an ambulance. And they asked, what healthcare company do you have? And since we are from Sweden, we had a very small one that wasn't covered, and I had to pay with a credit card to get her to the hospital.
So you're watching the presidential debates. Every corporate network journalist who hosts one of these debates, they usually ask a question about healthcare, and they say, are you going to raise taxes? Talk about how the Swedish people feel about...
He had to pay, he had to pay for a credit card with his credit card in order for them to take his daughter in an ambulance? Jesus fuck. Yeah, wait, the Swedish healthcare system doesn't hold literally everyone ransom. Yeah, it's weird. The Swedish healthcare system doesn't just immediately pull a gun on you when you enter the country and threaten to shoot you in the kneecaps unless you hand over your wallet. It's weird. It's weird. I know. I'm just used to getting shot in the kneecap so often here in the United States. I kind of enjoy the feeling. I feel like I'd miss it.
About this, because you're talking about an issue that unites people across the political spectrum in Sweden.
Yeah, nobody, not even the most conservative parties, would like to get rid of this system. And I think there are two reasons for that. One is that, or two misconceptions also in the US. One is that it costs us a lot of money in terms of taxes. Yes, it does. We pay way higher taxes in Sweden than in the US. But we have way lower expenses for co-payments for healthcare, health insurance, daycare, saving for children's college and so on. We don't need to bother about that. So the higher taxes for most people is more than offset by lower cost for other stuff.
So you say this makes Sweden far more competitive, while the U.S. says, no, this is much too expensive. You say it's too expensive not to do this.
True.
I would say at least it would make a country more competitive to make sure that everybody who is smart enough has access to the best education, and everybody who needs healthcare gets that, because then they will be able to be part of the workforce instead of worrying about health. And you, as everybody else in the West, need to compete with better and better companies in China, in India. And the best way to do that is not with the unhealthy, undereducated population.
Well, talk about school. You have Bernie Sanders and some others talking about free college.
Yeah, we have free college, so we don't pay any tuition for any university in Sweden, even the best ones that could compete on a global level. You can't have any tuition, which means that everybody who has the grades to join these universities can do it, and they obviously then takes jobs in our global companies and helps them compete on a global scale.
And talk about overall welfare, the issue, and what you think are the greatest misconceptions about Sweden.
Sometimes they describe Sweden as a paradise, that everything works perfectly in Sweden. It doesn't. You need to understand that everything doesn't work perfectly. But there is a difference. You don't need to worry too much about money. Everybody can send their kids to daycare because it's affordable. Nobody needs to worry, will I go bankrupt if I get sick? Because healthcare is almost free. And if you're smart enough and study hard enough in high school, you will be able to go to university.
And how do you answer questions here like, why should rich kids go to school for free?
That is a debate that is not easy. Some people would say that, why should they? But we decided, I guess, basically, it's the only way to make it simple. Everybody has access to the basic part.
Because means testing doesn't work and it creates cracks in the system that hurt people. So just make it a universal system.
Welfare as we see it, rather than checking your income, because that opens up for all kinds of
Exactly, Morpheus.
Well, I want to thank you so much for joining us. Mikael Törnvall, Swedish author and journalist focusing on economic issues at Svenska Dagbladet, a Stockholm daily. And that.
Thank you, Amy. Now, here's one of the other things, right, that we haven't really talked that much about yet, which is that by making public education free up to the PhD level, you also free up doctors from medical debt. One of the big reasons doctors try their darndest to climb the corporate ladder to make as much money as possible is not just out of pure greed, but also because often they are hundreds of thousands of dollars in debt from going to medical school. Medical school can be just insanely expensive. And you know what? We need not only more doctors, but we need more doctors that come from lower income brackets. Because this is one of the things that I think a lot of us intuitively know about, especially like doctors. But a lot of doctors come from rich families or relatively well-to-do families, and we need to diversify our doctors. We need doctors with a variety of perspectives that are willing to specialize in a variety of different fields and are willing to take their practices to different areas so that we have a good, diverse spread of doctors, right? Like, it's not, we shouldn't just have doctors, just like coagulating in cities. That's not the term, it's not the word I was looking for, but it's the one I got in my brain. We need to have doctors in rural areas. We need to have doctors practicing in remote areys. We need to have doctors concentrating. Thank you. That's the word I was looking for, Maro dear. I've been streaming for 8 hours now. This is a lot for my brain. I've been presenting information for about 8 hours. So give me some credit here, okay? This has been a full workday of me spewing information and creating content live for your enjoyment. So when we talk about doctors, we also need to understand that background can inform their diagnoses. And I think when doctors all come from a specific bracket or generally tend to come from a specific background, that causes the entire medical field to suffer. So I think that we should have medical school be free. Let's make medical school free, okay? And also get rid of student debt. Do both those things. All right, let's watch this video about the changing cost of medical school. because I'm sure it will elucidate a few points. Just showed up to this, loving it so far. Medical care in the U.S. is criminal after insurance. My partner and I paid $13,000 for the birth of our child, and that's low for some places. Tater Manmill, first off, welcome. Second off, we're doing a Medicare for All organizing stream, so I'm glad you're enjoying the content. And just as a reminder, everyone should be hitting thank you, Ashley. The Medicare for All, you guys were all on top of it before me. Click that link that Ashley just posted in chat to get involved with the fight for Medicare for All. It will inform you about all the struggles and fights for single payer on a state level across the United States. And it will help you get up to speed on the national fight for healthcare, Medicare for All. And it will kind of put you in a prime location to be tapped for further action in the future, to get you involved in actually fighting for Medicare for All. We can collectively do so much if we just get involved and do the work. So many people get dispirited and disappointed at the fact that, like, Bernie Sanders didn't win the presidency in 2016 and introduce Medicare for All and completely change the way things are done. But guess what? We're winning. We are winning slowly and surely, and we need to keep that pressure on. And the way to keep the pressure on is to get involved. So let's all get involved and do what we can to push this movement forward. I know I am. So I hope at least most of you are as well. That's the kind of community I want to create and foster on here. And that's the kind of goals that I want us to have. And Tater Manmill, I totally feel you. Even with insurance, I had to have a necessary surgery to remove my gallbladder, which was infected and causing me immense amounts of pain. And even with insurance, I still wound up paying $5,000 for that. It was ridiculous. So, yeah, something needs to give, and it's not going to be me. I'm not going to give first. The system's going to give first. Now let's watch this video about why doctor school is so expensive. And how we can fix that with free college education up to the PhD level, which, by the way, would lower the cost of healthcare for everybody, which would be really good, especially in a single-payer system. So it would actually cause prices in a single-payer system to go down. So if you're concerned about how expensive a single-payer system would be, you know, you want to make med school cheap too. Let's go.
We all know medical school is enormously expensive, with the average medical student graduating with $200,000 in student debt. But did you know that over a quarter of medical school graduates have no loans at all? This is the real cost of medical school. Dr. Jubal, MedSchoolInsiders.com. Data from this video comes from the official 2020 AAMC Medical School Graduation Questionnaire and the AAMC's report on economic diversity. Links in the description. Here's a trend that will surprise you. The percentage of newly minted doctors graduating with medical school student debt is dropping.
Well, fuck my entire point prior to this, I guess. But, alright.
2014, 82.6% of students had medical school loans, trending down to 70.8% of students in 2020. In terms of the debt distribution, approximately 50% of students graduate with debt between $100,000 and $300,000. Approximately 12% graduate with $300,000 or more, 12% with less than $100K, and 25% with no debt at all. The median debt for those who need to take
Wait, sorry, how are you? I know we're probably going to figure this out. How did 25% graduate from med school with no debt? How? Yeah, Tater Mill, that's one of the worst things. Like if I had to pick an individual worst thing about our current healthcare system, it's charging to let a mom hold her baby. Ridiculous. Yeah. Oh, yeah. By the way, for people who are watching who aren't in the United States, you literally get billed if you're a new mom who just pushed a baby out of their like body. You get billed to hold your baby. It's ludicrous, and you get billed hundreds or thousands of dollars.
Is going up, meaning the average medical student taking out loans is in more debt than the average from just a few years ago. But the fraction of students graduating with any debt at all is decreasing. In the 1980s, rates hovered around 90%. In 2014, it was 82.6%, and in 2020, we're at 72.3%. So what does this mean? There doesn't seem to be a simple and clear-cut explanation. This decreasing trend cannot simply be explained by a few medical schools offering free tuition, namely NYU, Columbia, and Kaiser. Nor is it likely that this can be accounted for by masses of medical students going to service contracts, such as the military, to cover their medical tuition. One possibility is that scholarships are increasing in number and in value, which is part of the equation, but I don't think this accounts for the whole story. The number of medical students receiving free money in the form of scholarships, stipends, or grants has slightly increased from 61% to 63% from 2014 to 2020. But the median scholarship amount has remained around $20,000 to $25,000. Or perhaps it's because more students from affluent families have parents who are footing the bill. For some time now, more than half of matriculating medical students have parents who are in the top quintile of income. Explaining that finding could be
Fuck that. We need more poor people doctors.
a separate video in and of itself, but what's important here is to focus on the trend, which seems pretty stable. In the last decade, there doesn't seem to be a shift to explain the large number of students graduating without debt. I'm not quite sure what to make of the data. What do you think? Let us know with a comment below. Another interesting finding is that 2/3 of matriculating medical students have no loans from their college pre-med years, which is surprising to say the least. On a national level, 70% of college graduates take on student loans with a median of $29,000. Yet only 33% of first-year medical students have any student debt, similarly with a median of $28,000. This is likely due to two main factors. First, the socioeconomic status of entering medical students is skewed towards more privileged backgrounds. Therefore, more medical students have parents who footed their college bills. And second, those who were successful in getting into medical school were very strong students, and were therefore more likely to secure merit-based grants and scholarships, thus reducing their loan burden. So what does this all mean?
Hey, friendly Danny.
The number of graduating medical students without any student debt is increasing. Maybe you're rejoicing and giving your friends high fives right about
I've been tagged in Discord? I did not want to skip ahead. I have something in my eye.
rejoicing and giving your friends high fives right about now. Not so fast. It's important for pre-meds and medical students alike to keep this data in perspective and understand the nuances of what it tells us. First, yes, it's great that close to 30% of freshly minted doctors have no med school debt. That's a substantial improvement from just a few years ago, and that's something to celebrate. But understand that the median medical school debt has been increasing, meaning if you're not one of the lucky 30% to graduate without any debt, your total loan burden is likely going up. More specifically, up from $180,000 in 2017 to $200,000 in 2020. Considering—
Yo, what? I'm sorry, it's jumping up by like $4,000 to $5,000 a year for no reason.
Median debt amounts have been steadily rising for the last several years, it's not unreasonable to expect that trend to continue, meaning if you're graduating medical school in 2022 or 2025, the median student debt will likely be higher than $200,000.
Jesus fuck.
Second, understand that when we talk about the median, that doesn't mean you'll necessarily graduate with that exact amount. You could be in substantially more or substantially less debt. In 2020, 11% of graduating medical students had between $300,000 and $400,000 in medical school debt. Nearly 3% had between $400,000 and $500,000, and about 1% had more than $500,000 in debt. third, understand the math that goes behind
showed you
student
my
loans
bun,
and
please
paying
respond.
them off. Too often, I hear students saying, 300K in loans is no big deal. I'll pay that off in 1 year as an orthopedic surgeon. Not quite. That $300,000 is going to be compounding around 6 to 7% per year during your residency training. So while you'll be making minimum payments, the principal will actually be increasing during that time. Even as an orthopedic surgeon pulling in 500K, you have to pay taxes, meaning you'll take home between $289,000 and $335,000, depending on your state income tax situation.
The horror. Can you imagine barely scraping by on $300,000 a year?
And out of that amount, you'll need to pay your mortgage, utilities, health insurance, your kids' daycare, car payments, car insurance, food, travel, Netflix, that new iPhone you gotta have, a new sim racing rig with a VR headset, and of course, save for retirement. And that's
Imagine being able to save for retirement and travel in the same year and have a mortgage. Impossible.
before making a dent in your loans. Suddenly, that 300K doesn't
Yeah, like honestly, I don't even know what I would spend 300K on. I guess I would travel places, but that's just so much money.
seem like such an insignificant amount, particularly when you add the reality of the compounding effect working against you with your student loan interest rates. And while there are many aspiring orthopedic surgeons, many are unable to match because it's one of the top 5 most competitive specialties.
I'm just like over here being like, I hope that one day I become a big enough streamer so that I can afford to move out of my parents' house. But oh well.
If you end up going into sports medicine, internal medicine, emergency medicine, anesthesiology, or something else, you'll likely be making substantially less than the average orthopod, meaning it'll take much longer to pay off your loans.
Paladin Lost,
While
I do
the
have
default path
VR.
in the United States is
I just
to
don't have
attend
the
an
space to set it
allopathic
up.
medical school, we cannot exclude the alternate paths from the financial analysis, namely osteopathic and Caribbean medical schools. The American Association of Colleges of Osteopathic Medicine publishes similar data in their annual survey, showing similar trends. In recent years, the median osteopathic medical school debt has been increasing from $256K
What
to
the
$265K. But similar to allopathic medical schools, the percentage that are in debt has been decreasing from 85% in 2017 to 83% most recently. Caribbean medical schools don't have a central organization publishing this data, so it's more difficult to
Phasmophobia
pin down
scares
an
me
exact
too much,
number.
though.
It's widely accepted, however, that students graduating from Caribbean medical schools have
I can't
a
even
greater
finish.
student loan burden
I can't
than
even
those from
finish
US
Amnesia: The Dark
allopathic or
Descent. You think I can do
osteopathic medical schools.
Phasmophobia?
This isn't a surprise, considering these schools generally have substantially more costly
Phasmophilia,
tuition
then?
and fees. Depending on the article and school you're looking at, a 40 to 50% increase in the median student loan burden for Caribbean grads compared to US allopathic grads is not out of the ordinary. That means close to $300,000. In terms of stratifying the financial cost of allopathic medical schools, osteopathic medical schools, and Caribbean medical schools, US MD schools
Outlast
generally have
isn't
the
scary
best
to
financial
me.
outlook, followed by DO
It's
schools
boring.
with Caribbean medical schools.
Okay, here's my guys. I know it's off topic. Here's my controversial video game opinion. The Outlast series is bad horror. Okay, you become numb to it within like the first 5 minutes. Outlast 2 desensitized me to its scares within like about 15 minutes. All right, just telling it like it is. Okay.
We've already discussed on this channel why the finances even for USMD graduates is not a clear-cut win. But what's concerning here isn't just that DO and Caribbean grads have more debt, but also the fact that greater proportions of these graduates end up in primary care and other specialties with lower average compensation. And while DO graduates have a similar residency match rate to their USMD counterparts, understand that a significant proportion of Caribbean medical school
I really adore the Amnesia games, though.
graduates fail to secure a residency seat. And without residency, they cannot practice as a board-certified physician, meaning they won't necessarily be making 6 figures per year. And unfortunately, those student loans don't disappear, even if you file bankruptcy. Imagine being
Thanks, Joe
$300,000 in
Biden.
debt with no residency position and no easy way to pay off your loans. I don't say this to scare you or discourage you, but to be realistic with you. That's what we're about at Med School Insiders. I care more about your success than your feelings. And if the numbers are making you uncomfortable,
Facts don't care about your feelings. All right, the rest of this is life advice. I don't care about that. So long story short, we would be much better served by not shackling our doctors with crippling amounts of medical school debt. There we go. How are people becoming doctors? Hypocritical Luddite. He said at the beginning of the video, over half of people who become doctors come from obscenely wealthy families.